Thank you all for braving the weather and getting here tonight. We have one board member, Shannon Mikula, is on the phone up here, so she will be participating via the phone, and Dr. Shab may join us at 7:30 by the phone, depending upon how she feels, so we'll go with that. We have the agenda to approve. Dr. Brenner, do you have any changes to the agenda?
No changes, Dr. Lund.
Can I get a motion and a second to approve the agenda? Motion by Chris, second by Doug. Assuming a roll call vote, all those in favor, please state aye.
Aye.
Aye. Opposed, same sign. Motion carries. Thank you. Let's move on to item 3, which is work session regarding finances and facilities. Dr. Brenner, you're going to kick us off, I understand.
Thank you very much. Page 2 of your electronic packet, there's a memo from me outlining the process that we've been through relative to the budget realignment process. So I'm going to skip right down to paragraph 3 and talk about our work tonight is to finalize the unacceptable means section of the document, the guiding change document. That was a live link in your electronic packet. So thanks to Dr. Lewis and thanks to Cindy for working her magic to make sure that that was in electronic form for you. So as requested at the December 13th meeting, we will do a review and refinement of both the current reality and the results sections. While our intention is to complete the guiding change document tonight at our work session, we want to ensure that we do get this right. If another work session is needed, we'll certainly ensure that that will happen. I have my own prediction that I believe we'll finish tonight. We'll see what happens. So with that, I'm going to turn it over to Dr. Lewis to continue with the framing of the conversation for all of us here this evening. Dr. Lewis.
Great. Thank you so much, Dr. Brenner. And as you can see projected up is also the document that many of you I see are on your devices right now. It looks a little bit messy, as we can see, but that's a good mess. So what we have there is we stopped midway through the unacceptable means, the not how, and this is again looking at our results section. This is not how we're going to realize our results section. So you can see that while Catherine's name is on there, my name is on there in the comments, that's actually reflective of the groups that we were in last time. So what we will start with is to work with our small groups and go through again and look at how are we feeling as a small group about each of the items in the not how. So we'll look, for example, start with number 1, expend below 8% of the general fund. Is that something that as a group you are okay with, or is that something that you want adjusted as your small group? So after we complete that, leave all of cabinet members, remember to do this all in suggest mode or editing, suggesting mode so that we can see what you're doing. Then when we come back large group, we will go through and finalize, we're okay with this, we're not okay with this, until we get to our consensus under the not how. Then we're going to swing back and look at the why, and then we'll swing back and look at the what. So for right now, let's start with 20 minutes in small groups to really hammer out where we all are with unacceptable means, and then we'll come back in the large group. Any questions or clarifications? microphone, how to project, and how to sit down all at once. So I'm just excited. It took me 4 sessions, but I've got it now. All right, team. We've got a lot of really good work, as you can see in the second section here. So our very first one that we're seeking consensus on is, Scott, I'm having a hard time. You're striking out the 8 there and putting it to 7, right? I'm asking? Or,
Yep, and the reason I did that is I looked at our budget for this year, and we're likely to be at 7. I think last time I put 8 when I meant 7.
okay,
So
perfect.
that's in effect how we budgeted for this year.
Okay.
But the numbers for the 10 and the 15% are certainly attainable. It's just I was off 1% for this year.
Good job, good catch, thank you. All right, so team, okay, I'm looking for consensus on this statement reading, the not how. Expend below a 7% general fund balance as of June 30th, 2022, 10% by June 30th, 2024, and 15% by June 30th, 2026. Looking for consensus on this one. Shannon, can you hear me? It's Brenda. Are you in consensus with this one? We have thumbs up around the room, looking if you're in consensus as well.
Oh, yeah.
Okay, perfect, thank you. All right, team, so I'm going to resolve that. Catherine, you did
Dr. Lewis,
yes.
may I may be getting too deep in the weeds on grammatics. Maybe that's going to be cleaned up, but below a 7, because it's a consonant for the S in 7.
Okay,
Perhaps we don't want to
can you
be doing
come
this. This
back
can
on
be,
that?
this can be
Thank you.
wordsmithed later,
Yep,
correct?
very
Okay,
good point.
thank-
Yep, thanks. Yeah, if you can resolve it so they turn black with exactly what we want. Okay, the next bullet on the document is actually looking for a strike through. So we are looking to eliminate the statement, again, not how, general fund balance once that level is established. Looking first to see if we have consensus on deleting that. If I'm not seeing consensus here, we can go into discussion, but. Shannon, can I get your vote?
Yeah, should I verbalize that, or if I just don't say anything?
Do you mind just saying
What's easiest?
agree for me?
Sure,
Okay,
will do.
I appreciate that.
I agree. I think it's covered under the first bullet.
Thank you. Lindsay, you want to resolve that for me? Okay, now I'm moving into the third bullet. Again, not how. Violate laws, regulations, contracts, policies, and core values. Let's take that language first, and then I promise I'll get to the parentheses. So looking for a vote, consensus around this one. Shannon?
Can I ask you a question just on
Yep.
I know what laws, regulations, contracts, policies are. Our core values, we have a list of those in the strategic plan, or where are we pulling those core values from?
Does the writer of that one, it was written last session in December, does the writer mind sharing about that, or the group that placed that one on here?
Yeah, I can't remember if that was our group or not, but I remember discussing it. I think really what we meant there was ethics. We don't want to violate ethics in general, ethical practices, in order to achieve that goal. That's a great question, Shannon.
Yeah, I just would suggest, because laws are defined set, regulations are defined set, contracts are defined set, policies are defined, but core values is kind of open-ended. Somebody's core values could be very different than what maybe the majority of the district agree to. So I guess that would be my suggestion, is if it's ethics, and that's like very clearly we have like professional ethics associations that set forth those ethics, let's use that. rather than the phrase core values.
Or would strategic plan itself, we, you know, we're not going to violate the strategic
Yeah,
plan?
maybe that's,
I was gonna say that, because don't we have values established in the strategic
Yep.
plan as well?
And strategic plan is carried later on in this list. So I'm wondering, team, how we feel about deleting after policies. I'm going to read that one more time. Lindsay's going to suggest that here for us. Violate laws, regulations, contracts, and policies. Can you, yeah, thank you. Looking for consensus on this one. Catherine, did you want and switch to or? Yep, we'll switch or. I heard you over there, thank you. Okay, one more time, team. Violate laws, regulations, contracts, or policies.
I agree.
Okay, thank you. Now I'm going to take the second part of that bullet, and it said, can we list this first? So looking for how people feel about listing that first. It's coming back. So moving violate laws, regulations, contracts, or policies to first.
Well, the question I had is there any semblance of order with any of these? And to me, that's the most important thing, is you don't want to violate the law. But if there really is no priority orders, then it really doesn't matter where it is in the categories.
So it's not meant to be, like you said, an exact, or not an exact order of importance.
Then it doesn't matter.
Okay.
I agree with Dr. Lund on that.
Okay, leave as is, looking for consensus, please. Okay, great, thank you. All right, the next one, I have to follow what we're, okay. So, I believe this one, our group from December 13th is asking how is it measured. I believe my group isn't here anymore, but that was actually a proposal around, was that deleting this one, President Lund? Did we ask to delete this one, our group? I can't remember either. Okay, so team, I'm gonna say that that's what that group's intention was to delete this one. So the one we're talking about is to delete inequitably financing curricular and co-curricular programs at the expense of another. Looking for consensus or not on this one?
Consensus to delete?
Consensus to delete. I hear you, Shannon, yeah?
So down a little ways, Scott had edited another one, but I want to mention it now. I think this concept really, I'd like to see represented in a broader concept dealing with the student experience. I don't see anything about really that consideration in this list currently with the strike-throughs. So I think this kind of fits under a student experience here. I don't know the right words for it.
Let's do this.
So I
Lindsay,
agree to
okay.
strike this, but want to note that I think the spirit of this is maybe somewhat captured in,
Thank
I
you.
don't know, inequitably degrading a student. I don't know the right words.
Well, let's come back to this one so that we can capture that student experience piece.
Yeah, our group had a similar conversation. We thought that it was captured in the perpetuated economic disparities. We thought maybe that needed to be wordsmithed a little bit, but we thought that was where that was captured, Shannon.
Yeah, I thought I saw somebody strike through. Oh, maybe they didn't strike through that one.
Okay, so team, given what Catherine weighed in here for us, I'm gonna call for another consensus around removing inequitably financing curricular and co-curricular programs at the expense of another. Shannon?
I agree.
Okay,
Sorry.
thank you.
Slow to
Yes.
mute.
Lindsay, go ahead. Okay, the next one I believe is duplicative of the first one, with just a little bit different numbers. Are we okay with deleting expend below the general fund balance of 10% by June 30th, 24, 15% by June 30th, 26? Shannon?
I agree.
Thank you. Okay. Here is that one that we want to make sure stays in some form because we just deleted the one ahead of it. So, perpetuate economic disparities between students, parentheses, buildings versus student, and then student experience. Got a lot to unpack here. Any proposals of how to wordsmith this, team?
Consider economic disparities between students. It kind of mirrored another fail too that I think might have been deleted. I think I heard at our table a little bit of concern over the word perpetuate, almost as suggesting it's currently happening in some sort of intentional manner. So,
Shannon, do you have a proposal for a stronger word than consider? That's just Brenda talking, not as the
evaluate?
facilitator.
I mean, evaluate or assess.
It's a not how.
Yeah.
Yeah.
Choose the words wisely.
I mean, is it something that we want to make part of the analysis is a intentional economic disparity assessment?
So I'm
Is
gonna,
that something that we think absolutely should be part of the means? Trying to frame it in the opposite.
just say, I don't know if it's really about our economic disparities are here. I don't think that it's necessarily intentionality around that. So as far as maybe we put in the front of it, continued perpetuation of economic disparities. Because when you look at our student achievement data, you see the disparities.
And as we see the disparities that exist, are we placing the perpetuation on people, process? Where does that land? And that's concerning to me. Members of the district may read that and say, what are they saying? Again, if we know that there are disparities, yet I don't want to put it in a way that it looks like we're pointing the finger at someone or something.
What exactly we
I
mean?
share that same concern that Chris is sharing.
What exactly do we mean by economic disparities? Because if we're talking, I mean, is that family incomes, which we have no control of or anything? So I don't know why we would refer to economic.
So if we look at our students that qualify for free and reduced lunch, you will see a direct correlation between the test scores and buildings that are designated as Title I or higher free and reduced price lunch. You will see substantially lower test scores, achievement scores, that is in those buildings than you would see in buildings that are not designated as Title I or have lower percentages of free and reduced price lunch. So if we wanted to push into this a little bit more, to your point, we don't have control over familial income, but we do have control over utilizing our budget process to align with and support the strategic plan work, elevating the DEIB work, diversity, equity, inclusion, belonging work, to ensure that our schools do not perpetuate that same level of disparities based on prediction of income, if that makes sense. So for instance, this could look like, and this is simply exemplary, not something that we're going to do. This could look like looking at the number of reading specialists that we have per building, and instead of a general district allotment by building, we look at the number of students not meeting standard, and then we look at how do we then budget to push out those resources based on the student achievement levels, attendance levels, all those pieces to really budget and staff on what we're seeing our data showcase in the schools. So that's, to me, what this is looking at. I'm not speaking to you right now as your facilitator. I'm speaking to you as part of the work that I'm charged to lead.
And I apologize if. Go ahead, Shannon.
Sorry, I can't see people in the room. I'll wait. Just let me know when I can chime in.
Go ahead, Shannon.
Go for it.
I was, that was why I almost suggested, Dr. Lewis, that, is this something that we need to actively start assessing? Is economic disparities present in the budget making process? So, said another way, I don't know that I in the last 4 years have had those types of conversations around budget setting. And so is it something where we need to say, we're affirmatively going to do that, so, we say we're not going to fail to consider that in our budget setting process?
So frankly speaking, I think this bullet, and I know it's in two different sections, I think this bullet resonates loud and clear, actually in the last bullet under the what.
A thought, and then certainly give me the feedback. Ineffectively fund required student needs. We're not going to ineffectively fund the required student needs.
Okay, you want to put that in there and we'll see. Catherine?
Another possibility, if this captures it, is something to the effect of by not confusing equal funding for equitable funding as it pertains to student programming or student supports and services, something of that nature. Because I think, Brenda, that's really what this is trying to capture, that you're trying to articulate or are articulating, is that we need to look at our allotments through a different lens.
Yeah. Yeah.
But again, when we use words like equal versus equitable, well, does this document need to be easily understood by all of our constituents, or is it mostly for our inner workings that might not resonate with everybody the same?
You want to put, Catherine, can you repeat that so Lindsay can put that up there too?
Confusing equal funding for equitable funding as it pertains to student services and programming. Yeah, as it pertains to student services and programming.
Okay, so the first, Catherine, was your proposal to have this be a separate bullet or to have it all be one statement? Ineffectively fund required student needs, confusing equal funding for equitable funding as it pertains to student services and programming.
It was meant to be its own bullet
Okay.
in lieu of the others, but it's just a different way of stating it. Yeah.
Okay.
I'm
You
good, I'm good with that.
Team, I'm going to call for consensus now on this wording. Confusing equal funding for equitable funding as it pertains to student services and programming. and we're going to strike the rest of it. Looking for consensus here. And I'll read what we were striking. Shannon, my apologies. Do you have the live document in front of you? Okay.
I do. There was the phrase that just got deleted that was added though. I liked that better because that made more sense to me than confusing things.
You want to do undo for me? Okay, 1 second, Shannon, we're hearing you. Okay, so it's back now. So let's take the first one. Actually, team, I'm going to ask you to show me either 1 or number 2, because they're both saying the same thing different ways. So let's start there and then we can funnel down. So number 1 is ineffectively fund required student needs. Or number 2 is confusing equal funding for equitable funding as it pertains to student services and programming. Which of those do you prefer?
Can I?
Go ahead, Shannon.
Well, I was going to say 1, but can we kind of wordsmith this? So, because I think ineffectively isn't the right word. I think it's inequitably fund required student needs, including student services and programming.
Okay, let us catch up here,
I don't know if
Shannon.
that.
Okay, we're
Sorry,
just typing it. No.
kind of clicked for me.
Okay, so we've got inequitably fund required student needs.
Including student services and programs.
As it pertains.
Can you type including student needs and programs? We're just catching up, Shannon. Sorry about that. No, that's okay. Team, I've got a little bit of a question, not as your facilitator. I think we're already doing this, required. Required to me says law required. Is there a different word we can consider, or are people okay with required student needs? Because it's not required by law that a lot of the work we're doing. Do you see what I'm saying? So I think we're already doing what we are required to do.
Why don't you drop required altogether?
Okay? So okay, so we've got a little bit of an issue here. We've got inequitably fund student needs, including student needs and programs. 2 student needs there.
Just take out the
It's
second one.
supposed to be including student services and
There
programming.
we go. Thank you.
I've
Okay.
taken the last half of yeah, there you go.
Thank you. Okay. Calling for consensus on this statement. Inequitably fund student needs, including student services and programs. Period.
Are we voting 1 or 2, or are we voting separate now?
We're voting to have this one be its own, keeping it there as its own. Okay? Not really consensus here. Can any of our thumbs down folks propose a change here?
Well, I guess what I'm wondering about is if that's going to be by itself, then is the next one going to be there too? It's going to be, to me, covering the same ground. So, I mean, to me, it's 1 or 2, not this one and then, you know.
That would be deleted. Okay.
So really it is 1 or 2.
Okay, so
I kinda
with
like
that being, now with this, let's take it all in that big chunk. So are people okay with consensus around inequitably fund student needs, including student services and programs, thereby deleting confusing equal funding for equitable funding as it pertains to student services and programming, continued perpetuation of economic disparities between students, building versus students, student experience, perpetuate disparities among programs. So all of that would be deleted, and replaced would be that inequitably fund student needs, including student services and programs. Okay, can you weigh in on what you would like to see different?
I'd like you to delete the first two lines and put the other ones back in. To me, it makes more sense to me. But again, it's not an absolute, it's a consensus.
Yeah, I'm not sure that I'm more with Eric. I mean, to me, this almost could just be, because this is a negative, continue perpetuation of educational result disparities between students, and that, to me, just covers it. Whether they're economic, whether there are other reasons, we don't want to perpetuate different results amongst kids. But I would prefer confuse equal funding for equitable as it pertains to student services and programming just by itself, better than the first one.
There we go. So we're setting these apart. Thank you. So right now, we have two proposals on the table. The first one is inequitably fund student needs, including student services and programs. The second one, instead of that one, would be confusing equal funding for equitable funding as it pertains to student services and programming.
I think the question to consider is which one will be better understood by our community.
And confusing is vague. I don't know what that means, and it can mean different things to different people. The third one, I'm fine with that, but it's gonna require an assessment almost implicitly, which is fine. So I like the first or the third. I just don't like that word confusing in the second. Because I don't know what I'm not supposed to do.
Okay, team over here, any adjustments that you think we could make to confusing? To the word confusing?
Like, if you're not confused, then you know, right?
I think it kind of goes back to what you said earlier, Shannon, about just assessing for inequities, right? So if we're failing to assess for, I would assume if we assess for these inequities, that's where our money is going to be placed. Because we have it in the strategic plan that we're going to be looking at diversity and inclusion. And so really what we want to avoid is failing to assess for inequities when it comes to funding services and programs, right?
Yeah, but that's not what we're saying. We're just saying confusing, which what you said's a lot more words, and yes, I agree with what you're saying, but I don't know that everybody would agree with that when they just read the word confusing.
Shannon, is your,
If we went with number 2.
Shannon, is there a different word we could put in for confusing that would work for that second statement? Or a different way we could word that? Okay.
Well, but what we're saying is we're not going to equally fund, we're going to equitably fund. I mean, I get what the intent is, but I think that's what the inequitably fund student needs, including student services and programs. So our goal is to equitably fund, not inequitably fund. I don't know how one confuses equal with equitable. I don't know what that looks like, is my concern.
Okay.
If I could just offer a suggestion, since district leadership is going to be tasked with coming back with scenarios for the board, for me, the first bullet, cuts right to the chase. That means we look at our student achievement data, we look at our student absences, we look at our subgroups of students, and that bullet tells us where the money should go, how we align our budget. That's just from my perspective, knowing how we're going to have conversations in the future.
Okay, are folks that are concerned about deleting the confusing equal funding for equitable funding as it pertains to student services and programming, is there anything from that bullet that we could add to the bullet Dr. Brenner just referenced to capture what's missing?
No, I'm good with it. It's not a sword to die on, that's for
Okay.
sure. The one thing I don't like, and it sounds like we will eliminate, is I understand the concept of economic disparities, but I think there would be a lot of confusion in the public about if we have that economic disparities in there, because we aren't gonna make everybody's income 150,000. And I think that's what would confuse people. So I'm fine with one or two, so either one I can live with.
And I think what you just said is really picked up in and equitably fund student needs, including student services and programs. Yeah. Okay, team, I'm going to call back for a consensus vote here on keeping and equitably fund student needs, including student services and programs, while also deleting confusing equal funding for equitable funding as it pertains to student services and programming, continued perpetuation of economic disparities between students, buildings versus students, student experience, perpetuate disparities among programs. So can we keep and equitably fund and delete all the way up to the bullet, student needs are not compromised? Shannon?
I'm sorry, Brenda, you cut out. Keep that first bullet and deleting the second two ones
Yes,
that
exactly.
are spaced out?
Yep.
Okay, yeah, I'm sorry, I agree.
Okay, perfect. All right, Lindsay. Yes, thank you. Okay, thank you, team, for that. Very thorough, productive conversation on that one. Excellent. Okay, this was a double negative. I think this was the group I was in asking to take off not. So since this is not how, we're just proposing take off not for eliminating key tenets of our strategic plan. Just a grammar cleanup. Shannon, you good on this one?
Agree.
Okay, thank you. Lindsay, go ahead. The next one, took. We're deleting. Failing to increase facilities funding to levels necessary to achieve facilities plan. And again, this is that double negative. The proposal is underfund facilities. So the not how is underfund facilities. Shannon?
I think it's short and sweet. I'm wondering if Chris Arnold's in the room, if like there should be more guidance in that, just underfund facilities full stop, or is it underfund facilities to achieve facilities plan? I'm just curious, the initial wording included the facilities plan and whether we're losing something there.
I would agree. I think we should have underfund facilities plan, or whatever the plan
Okay.
is that we have to fund it. Otherwise, it's pretty, I agree with Shannon, it'd be pretty broad to, what does facilities mean?
Okay, team, can we consensus underfund facilities plan? Shannon?
I agree.
Okay, thank you. Lindsay, you can delete all of that. The next one, oops, can you put deviating back for me? Thank you. The next one, that was we're calling for deletion of deviating broadly from board articulated class size policy 6151, too large, not too small. As a reminder, that's picked up in the second bullet with policies. So how can I get our, I'm looking for consensus around deleting that one.
I agree.
Okay, we're good on that one. Thank you. Looking for consensus around deleting no further cuts to art and music programming without seeking alternative funding sources. And by the way, the second part of that is articulated in the next bullet. Shannon?
I think it's captured in the inequitably and that next one, so I
Okay, thank you. So the next one, the proposal is to strike, fail to consider all available funding sources prior to making programmatic cuts, and instead have limit funding sources. The not how is to limit funding sources. Shannon?
So this was one I think at our table that we liked the fail to consider available funding sources prior to making programmatic cuts. I mean, we don't want to just limit funding sources. We want to, and I think Scott put it well when he said we want to grow funding sources. So just limit funding sources doesn't, to me, it's kind of like the underfund facilities plan. It's short and sweet, but I don't know it's specific enough.
Okay, so your proposal is to have it say, fail to, you want, the,
And I know that's the double negative thing, so I'm trying to think on the spot of how to reword it. I didn't like the all, because I can't speak in absolutist, so I think to say all available, but I think available funding sources. And it doesn't need to, I mean, maybe not prior to making programmatic cuts, we don't need to get that specific, but I'm noodling.
Shannon, can you state for us, do you want it to, are you proposing the language to be fail to consider available funding sources? I took out all.
Yeah, and I guess maybe whoever offered the limit funding sources, is there particular concern or issue with the fail to consider?
So that was me rectifying the double negative. This is Brenda. So the proposal on the table, someone was going
Could
to
you
say
just put
something.
considering all available funding sources, since that gets rid of the double negative? Or considering available funding sources? Right, so not considering.
Okay. So team, this has been rewritten. I know. So this would say the not how is not considering available funding sources.
Scott, is this covered somewhere else in our policies or elsewhere that we're going to search out available funding sources? Is this not covered somewhere somewhere else. Problem is, it's so vague that I don't know if people are gonna understand it.
Yeah, I can't think of a policy that, something that drives us to look at all available funding sources for a solution. Yeah, I don't know, I'm trying to think of something.
What
that would-
what about neglect available funding sources? I don't know. I don't like that one either.
What this means for us from a leadership team, I'll give you an example. There are reimbursements that we can get through special ed, through Medicare, based on students and IEPs and assessments, and we're digging into that even deeper than what we've done in the past. That would be one example of how we can generate revenue. Another would be our workman's comp insurance. By having Gina Wheeler on staff, that position pays for itself rather than adding another FTE. So I think that's what this means, not just looking at Tanya Schleicher. Look for some money to fund this position. That's not how we're using her services, but we're using her services rather in alignment to the strategic plan. So consider available funding sources. For me, that works.
I mean, I don't think we can just keep it as that. Maybe ignore available funding sources? That's the not. We don't want to ignore it. We want to.
Okay, someone has asked me if we can change our consensus votes to using lighters. We'll table that one for right now. So proposal on the table is ignore available funding sources. Again, this is the not how. And we'll delete limit funding sources. Also deleting, fail to consider all available funding prior to making programmatic cuts. No, that's okay. So the wording we are voting on is ignore available funding sources. Shannon?
I like that one. I'm wondering, because we struck, well, we're going to get to it, make decisions without stakeholder input.
Okay,
I don't
hold
know if
on
you
that
can
one.
combine them. They kind of stand on their
Yeah.
own, but I agree with this wording.
Okay, perfect. All right, give us a second to catch up the document here. Lindsay, you want to take out, yep. Okay, proposal on the table to delete the statement, no decisions based purely on emotions. This table over here, thank you. Okay, we're good on that one, thank you. The next one is to delete the statement, make decisions without stakeholder input. That's being proposed as deletion.
Can I ask why?
Our table talked about that was pretty subjective and hard to measure. I'm sorry, we're on the stakeholder one, right? Jackie, do you want to chime in on what you said on that one? Shannon, I was answering the emotion one. My apologies.
Yeah, with stakeholder input, I think it's something that, well, we naturally do. And so I think what this is getting at is that we would make sure that we do it, which we do. I feel like it's probably captured somewhere else because it's just part of our roles already. And I do fear that this is a little bit too broad because one of the things I've learned sitting on the board is that we can seek out stakeholder input and then, certain pieces of certain stakeholders might say, oh, we didn't do enough in a certain area. Maybe we didn't describe a budget or a building enough, or we didn't, describe a job enough or something, which we would have had that covered internally. We just haven't shared it with outside resources. And so I feel like it's just a little bit too broad and gets us into the weeds a little bit.
Going to call for consensus on deleting that one. Make decisions without stakeholder input. Shannon?
I think this is already in our policies, acting in the best interest of the community at large. So I'm okay with deleting it because I think it's under the violate our policies.
Okay, you're getting head nods from colleagues here too. So, okay, we'll delete that one. And then we're down to the last one again. This is carried up in the policy one. Proposal to delete unreasonable class sizes, too large or too small. Looking for consensus on this one. Shannon? Okay, perfect. Team, nice work. So now what we're going to do, there was the request to revisit our current reality of the why and then the results, the what. So it's 6:40. Let's work in small groups here until 6:50 on current reality of the why of any changes your group wants to make there. As a reminder, not saying we can't make changes, but we did spend a great deal of time on these, so maybe it's what I would call maybe not substantive changes. Not saying you can't change them, but we're not starting from ground zero either. So let's come back together here at 6:50 and we'll see what the small groups have. Yeah. Yeah.
Okay.
Proposal, strike unable, replace with challenging to attract and retain adequate staff. So moving from unable to attract and retain adequate staff to it saying challenging to attract and retain adequate staff. This is our current reality. Shannon, we've got consensus in the room. How about you?
I agree. Dr. Lewis, I just have one comment on one of the other bullets.
Okay,
And I think what it comes down to is I understand the concept, and I think it's probably an accurate statement. My concern is just the word excess.
Shannon, which
In
bullet are
that-
you on? Four.
The fourth bullet right there, excess number of
Got
buildings
it.
and employees per student. So I noticed that the what uses the word optimize staffing levels. So my concern is, when we say we have an excess number of buildings, and then we know we're adding buildings in the near future, how that gets played, that word excess. I'm almost wondering if the why is a need to optimize the number of buildings and employees on a per student basis.
Okay, so Lindsay, can you capture that for us? Shannon, just hold on 1 second while we capture that. Shannon, you want to double check our wording there to see if that's what you proposed. A need to optimize the number of buildings and employees per student. Per needs,
I said on a per student needs basis.
on a per student needs basis. Got it, thank you. Can you double check there that we've captured it, Shannon?
There's an extra per after employees if you want to
Okay,
omit
thank
that.
you. Okay, look good? Okay, team, I'm looking for consensus around a need to optimize the number of buildings and employees on a per student needs basis. Eric, want us to revisit it? Okay. Shannon, we're pausing to think for a second. You got it? Okay. We have consensus on that one.
Okay, yeah, I like that. I like that better.
Okay. Team, anything else before we move on to the results, the what? I'm getting nudged to say, let's go. Okay? Let's move to the what. You were pretty quick with the why, so let's come back to this one at 7 o'clock on the dot with any proposed changes. We may come back earlier, it looks like. done, so we are ready. So there's a proposal on the second bullet to strike establish excuse me. So the new wording would state sustain a strong building fund to ensure highly effective and equitable teaching and learning environments in alignment with strategic priorities, and then striking the rest of it. Looking for consensus around this change. Shannon? Shannon, are you still on the phone? Maybe not.
Yeah, sorry, I agree.
No problem. Okay.
I
All
would-
right. So we have consensus around that one. Lindsay is picking that up, correcting that for us. Okay, the next bullet that we want to move down to is the one that I just highlighted on the screen for you. It says fund long-term facilities, that one. So you'll see the proposal is fund long-term facilities plan that increases efficiencies. Looking for consensus around this new language. Shannon?
I agree.
Okay.
Dr.
Sorry.
Lewis, Cynthia Shav is also on the
Oh,
phone
my
now, too.
apologies. Hi,
No,
Cynthia.
just within the last couple minutes.
Okay. Thank you. Cynthia, do you have the live document in front of you by chance?
Yeah, I've been following the whole time, thanks.
Excellent. Okay. I'm going to move now to the next bullet here that says achieve a sustainable balanced budget. Okay, achieve a sustainable balanced budget with an adequate general fund balance of 15%.
I struck through the 10% and the 15% after that because that's in the not how. So it's like we have to pick one or the other where we don't need it in both.
Thank you. Team, looking for consensus around this statement. Cynthia?
Yes, I'm good with that.
I agree.
Thank you. All right. So team, that is all of our work there since tonight we just finished the unacceptable means. So I'm going to turn it back over to Dr. Brenner. I just want to personally thank all of you for your trust in this process. And someone at this table said it is just wonderful to see it all come together in this document. So thank you, team, for some real hard work that will align us so well.
Thank you, Dr. Lewis. I don't know that there's much more to say other than what we will do from here. There are actually a couple of paths to take. One is to bring the Finance Committee back together and give us a charge relative to what a target number might look like based on this document that you have in front of you. And then what leadership will do is put together some scenarios, likely 3 scenarios, not more than 4, for your consideration that would align with the why, or excuse me, the not how and the what, and bring those back to you. So I see it as a multiple step process as we move forward, but we do have a document now that is more than just limestone, Dr. Lund. I think since we've come to consensus through all of these pieces, the why, the not how, and the what, I think we're really ready to go and roll up our sleeves. Anything else from district level leadership? Okay, Dr. Lund, that concludes our activity.
Thank you. Dr. Brenner or Dr. Lewis, could somebody send out this completed document to all the board members? Why don't we take a 7-minute break so we can reconfigure the room, and we will start back at, well, let's just say 7:10. discussion? We have a motion by Doug, second by Bill. Assuming a roll call vote, all those in favor, please state aye.
Aye.
Aye. Opposed, same sign. Motion carries. Thank you. Let's move on to item 5, which is public comments. We are a little ahead of time, so I know we have one public comment we'll make, but we may have to intervene in 20 or 30 minutes if somebody else wants to. So I have one blue card right now, which is Josh Mason. Josh, if you could come up to the...
Adjust this for my long neck here. Members of the school board, Dr. Brenner, my name is Josh Mason. I'm here today not as a health professional, not as a scientist, but a parent of children attending school in the Grand Forks Public School System and the spouse of a Grand Forks Public School employee. With the Smart Restart plan of moving to masks recommended instead of masks required, I wanted to emphasize that I am simply here to strongly support the move for masks to be optional for those that feel like they want their children to wear masks. If a parent decides that a mask isn't necessary for their child, then that should be up to the discretion of the parent. Masks are categorized in the medical community as PPE, personal protective equipment. They are intended to protect the individual person wearing it. If some feel as though a mask protects them, then by all means wear the mask. But again, I'm strongly in favor of you continuing with the Smart Restart plan of masks recommended for all students and staff. It should be optional and an individual choice. The thought of any possibility of reinstituting a mask mandate due to COVID quite honestly nauseates me. We have presumably wasted many resources by requiring masks in that masks are being provided by the school. School staff have presumably wasted a significant amount of time in meetings planning to stop a virus that appears to have little to no effect on children. Also, teachers are being asked to police mask wearing by students in school. Surely there are much bigger disciplinary factors that should receive more attention than mask wearing compliance. My children have experienced unnecessary anxiety caused by their peers, who are often insisting that my children put your mask up when taking a break from wearing their mask in the school setting. This is causing undue stress and anxiety for both parties. Surely we can have a more collaborative environment in our schools when our children aren't worried about who is and who is not wearing a mask. Other school districts in our immediate area, including Holy Family St. Mary's, East Grand Forks Public School System, do not have a mask mandate. Sacred Heart School just recently dropped their mask mandate for all their students and staff as well. It makes logical sense that the Grand Forks School System will execute this similar policy of masks recommended as those school districts in our own backyard. Although I don't have any immediate data at my fingertips, I can only imagine the negative impact that mask wearing has had on the academic development of our youth, particularly those in early elementary education. As previously stated, the mask mandate has also produced unnecessary anxiety in my own children to where they've often expressed not wanting to go to school because they have to wear a mask in school, even though they do not have to wear a mask anywhere else in the community that we frequent. Again, I want to express my sincere support of the board's agreement with the Smart Restart plan of making masks recommended and not required. Thank you for your time.
Thank you, Mr. Mason. Let's move on to item 6, Superintendent's recommendations for discussion. Review of the school board norms, which is on electronic page 6. Bill.
Yes. Be prepared, be on time, value and respect each other, exercise thoughtful deliberation and conversation, be professional at the board table when visiting with the general public, speak up when the norms are not being followed, advocate on behalf of students, and keep the community in mind.
Thank you. Let's move on to item B, which is the Smart Restart update on electronic pages 7 through 9. Dr. Brenner.
Thank you, Mr. Chair. I'm just going to take you through this memo, but I do want to provide a little bit of a prelude to this memo. The CDC, the North Dakota Department of Health, are making adjustments almost in real time. So things that were written last Thursday may have changed by today. So I just want to let all of you know that there could be some additional adjustments to our planning as our committee met last Thursday on January 6th. And I'll just move to the second paragraph now because we already have an update for you here. I talked about in this paragraph about January 17th being a professional development day. We'll have hundreds of certified staff members in the Red River Performance Hall and the Red River Small Theater. Masks will be required for staff participating in that professional development. As of this afternoon, our leadership team met and debriefed, and we talked about the rapid spread of the most recent variant and what we're going to do, and a communication will be sent out to all of our staff. The adjustment that we'll make is this will be a live stream event so that all of our certified staff can remain at their own school and still participate with the keynote speaker. So we won't have everybody in the performance hall and in the small theater at Red River High School. That's one adjustment we've already made since last Thursday. Next, I'll take you through what the recommendation is, and some of the recommendations have been updated, but I will cut right to the chase. As per Mr. Mason talked about just a few moments ago, the Smart Restart Committee did not make any alteration to the recommendation effective. Actually, it would be January 18th when students return, and that would be masks recommended as opposed to masks required. So looking at the second bullet under effective January 17th, masks will be required, however, for programs that include immunocompromised students or employees, and masks would also be required for Head Start classrooms and also early childhood special education programs, both programs that have students under the age of 5 who are not eligible for the vaccine. And those conversations have already taken place. The final bullet under that, all individuals using transportation will continue to wear face masks, as this is a U.S. Department of Transportation requirement, not a school district requirement. So the Center for Disease Control recently made several changes to their recommendations, and again, some of these might be updated by this evening or tomorrow. They have shortened the recommended time for isolation, and I want you to know that isolation and quarantining are used interchangeably between the CDC. So that shortened time period for isolation is individuals who are asymptomatic or symptoms resolving, that means fever-free for 24 hours, would isolate for 5 days. What we had discussed last Thursday, which may have an adjustment, individual must wear a mask for 5 days following that 5-day quarantine or have a negative rapid antigen test. And again, that piece might be reversed, that last sentence. So stay tuned for more on that, but we can certainly talk about that when I conclude here. On the next page, page 8 at the top, updated quarantine period. This could differentiate between 5 to 17-year-olds who are not eligible for the booster yet versus 18-year-olds who are eligible. So under the updated quarantine period, if vaccinated and received a booster shot, individuals do not need to quarantine. On day 5, the individual should take a COVID-19 rapid antigen test. If vaccinated with the second Moderna Pfizer dose within the last 6 months, and that 6 months might change, individuals do not need to quarantine. On day 5, the individual should take a COVID-19 rapid antigen test. If unvaccinated, individuals need to quarantine for 5 days. On day 5, the individual would need to receive a negative COVID-19 antigen test before returning to the building or wear a mask. If more than 6 months out from the second Moderna Pfizer dose and haven't received a booster shot, individuals need to quarantine for 5 days. On day 5, the individual would need to receive a negative COVID-19 antigen test before returning. If more than 2 months from the Johnson & Johnson and haven't received a booster shot, individuals would need to quarantine for 5 days. On day 5, the individual would need to receive a negative COVID-19 antigen test before returning. In any case, if symptoms occur, the individual should immediately quarantine until they receive a negative COVID-19 antigen test. And then you can see the link there for additional information. We do have on site, we have the the antigen testing availability for staff and students. We would still really urge people to use the Fritz Pollard Center on the campus of UND. I do understand that as of this morning, the lines were getting quite long again, where it has been quite efficient under the stairway. So I'm not sure if public health is going to shift and add more people and go back to the more of the football field concept like they had earlier. So regarding quarantines, individuals who are susceptible and have been identified as a household contact for COVID-19 will need to quarantine for 10 days. So that seems to remain a constant. And in terms of contact tracing at the building level, we really worked through this with public health to find a good balance so that our principals and secretaries can both manage their day-to-day operations and do contact tracing. Families will be notified if a positive case is confirmed in their student's classroom. So at the elementary level, that's pretty easy. At the middle school level, we have more students who move from room to room, and certainly at the high school level, we have students moving from 6 to 7 to 8 periods a day. So Dr. Arison at Red River did a little trial run with one of his administrative assistants, and just taking one student's name who has 7 classes, the secretary was able to generate a class list of all the other students who would be affected, who would have come into contact or been in that same class with that student, and then we can notify those parents that there was a positive, and we would ask you to monitor your students' symptoms. And then certainly if there are some symptoms, parents should really have their student tested before returning to school. And as always, we'll continue to review the local school and COVID-19 data. I will share that today we had a fairly large number of certified staff who were absent. That was a very large uptick from the week before. So we're seeing the effects of some of the rapid spread as that's moving across the country. And then again, we'll continue to use our points of consideration chart to make decisions. And based on what I saw in the teacher absentee piece, that is probably something that would require us to rethink this decision at some point in the future. But this is under discussion, like it has been the last 2 meetings, but I would say that the Smart Restarts recommendation is to continue to proceed with moving to masks recommended when students return on January 18th as opposed to masks required. And certainly leadership will take questions from board members and respond to those questions or concerns.
Any clarifying questions or comments from board members? Shannon, any questions or comments?
I just have a question related to the post-quarantine isolation if you're vaccinated. I got a little bit lost, and I just want to make sure that I'm understanding, because as I understand it, if you're vaccinated and you're a close contact, the recommendation is you need to wear a mask for 10 days. And if you don't exhibit symptoms or you test negative after day 5 of your last contact, you're still recommended to wear a mask for 5 additional days. Is that captured in this? Because at least that's what Department of Health is informing the public of.
Yeah, Shannon, good question. That might be one of the updates that we would need to adjust in our document that we wrote last Thursday. What we do have presently under the quarantining period for vaccinated who have a booster shot, individuals do not need to quarantine. On day 5, the individual should take a rapid antigen test. We don't have anything about masks under that one, but that...
Yeah, I would check that, because I think that's one of the updated, even if you're vaccinated. I know that's the recommendation. Now, whether we're following that or not is a question. I would imagine we should, just to give ourselves the best shot of not having to lose a bunch of staff unintentionally, or students for that matter. But yeah, I think the rest of it aligns with what I understand to be the current recommendations, and I think it's the goal for me is always to try not to disrupt as many students and families as possible. So one of the other things, and forgive me, I might have misheard, but I can't remember which category it was, a household contact being quarantined for 10 days, I think, if you're unvaccinated. Is there, I didn't hear in there a testing out protocol. I'm just wondering, because I believe in even the North Dakota Department of Health guidance, there is a test out after day like 5 or 7 if you've tested negative at day 5. Was that something that was considered?
Generally speaking, there's a recommendation to do a test between day 5 and 7. If someone sits the full 10 days, there wouldn't necessarily be a need for a test, because even if they were positive, that would, fulfill that 10-day infectious period.
Thank you, Shannon. Jackie?
Yeah, my question was in relation to our protocol for household contacts. Are we going to be, I guess, enforcing that household contacts do stay home when we're made aware of that? Because I'm aware that some districts do not enforce that and allow children to come back even if like a sibling has tested positive or something along those lines.
Yes.
Cynthia, do you have any clarifying questions or comments?
Was that a yes to we're enforcing a quarantine isolation for household contacts?
Yes, as of today, yes.
With no test out option?
Unless we're advised otherwise.
I couldn't hear. I heard a woman's voice, but I couldn't fully hear what was said, and then I might have clarified my question.
Cynthia, are you still online, and do you have any clarifying questions or comments?
No, I'm
Okay.
coughing too much to ask a clarifying question.
Okay.
No, thank you.
Well, I'm sorry that's occurring to you. Jackie, you had follow-up?
I just feel like I need to say that I still fully support requiring masking in our schools. The last 7-day period, I believe, if I'm not mistaken, in the state, we saw the highest number of student cases than we've ever seen in a 7-day period. And that says something about the spread and the contagion happening right now. And certainly we had more severe measures and more protective measures occurring before when we had lower numbers, right? So it seems very ill-timed to be removing a requirement. I think that's one of the things that will allow protection, will allow for, hitting the most people, because it's going to be very difficult to say, well, you're on day 5, you're on day 6, you're on day 8, who's supposed to be wearing a mask, who's not supposed to, who can I keep straight? Who keeps that straight? We're really relying on people doing their best, as opposed to having maybe just a blanket protection available. The other thing I worry about is that day 5 adjustment by the CDC has the 5-day mask requirement up until day 10, right? So you quarantine for 5 days then, or isolate, however you want to say that, and then you wear a mask for 5 days. That recommendation includes wearing a mask at home. That's strict masking when you're around others, period. What we do know is that people have to remove their masks at lunch at school. How do we determine that? Do we separate people? Do we not? So those are the questions that I have going on in my head. And so to me, I think masking is one protective factors that we can control as a district, aside from distancing, which is quite difficult for some of our schools. And I still believe that we should be data-driven and not date-driven, not politically driven. And so I believe that the data is telling us that this is a time when we should be having that protective factor. But I do want to say to people in the public, I do want people to get vaccinated, please, because I think that's the one thing that's probably going to help us the most.
Thank you. Other clarifying questions or comments from board members? I just have a few, and I spent some time last week talking to my colleagues down in Fargo, including members of the Fargo School Board, some infectious disease experts in Fargo that consult with the schools. And I think their thought process and my thought process are very similar. You know, this COVID-19 pandemic is following most of what the pandemics have done in the past, including the influenza pandemic in 1919, with various waves and various mutations. It really hasn't surprised any of the people that know about pandemics. It's acting the way it has, and it's following what it's done. And it's not going to ever go away, as I think most people now agree. It's going to end up being endemic. In other words, it's going to be low-grade levels. Whether it's seasonal or not, I don't think we can decide, but it's probably not going to go away. And at some point, and I think you're seeing it at least across the U.S., society has to open back up. I think specifically about this variant, the Omicron variant, that is good and bad. It's bad in that it's much more infectious, much more contagious than the other variants. On the good side, it seems to be much less lethal than the Delta variant or the other variants. The other thing that's kind of disconcerting right now is that the latest research on cloth masks shows that doesn't really do much for this variant. And so I don't disagree with Jackie. I agree with Jackie. I think masks are good to have. I would encourage families that are going to use masks that they consider using a surgical type mask like I got at CVS, or N95s, or even better yet, the KN95 out of Korea, because they make this duck-billed mask that actually fits kids. The other ones don't really fit kids. But I think people need to remember not to forget the basics, and I think people have forgotten the basics. Hand washing. If you're sick, stay home. And I can tell you the worst group of people with that are doctors. I see doctors all the time, and I've been guilty myself of going to work when you're sick. If you're sick, don't go to work, don't go to school, stay home. And I will reiterate what Jackie said. The only thing that's been proven to be really, really effective is vaccination. And it doesn't eliminate it, as we know, and if all you got to do is read any paper anywhere. People that are vaccinated can still get this, but most of the people that end up in the hospital and most of the people that are dying are, number one, they're in high-risk group like Bill and I here, and they're unvaccinated. So vaccinate your kids, vaccinate your teenagers, vaccinate yourselves. That's really the best thing. But in talking to my colleagues in Fargo, they had some of the same discussions last week, and my understanding is they're meeting tomorrow. My understanding is they're going to continue with their plan of recommending masks after January 17th. The other thing we talked about is that the Fargo School District and the Grand Forks School District are the only entities in either our metropolitan areas that are mandating masks. So the kids are wearing masks in school, and then they leave school and they go to their friend's house, and none of them are wearing masks. They go to UND hockey or NDSU football, and none of them, 15,000 people are not wearing masks. And so it's not occurring. I think if people want to stop community spread, it's not going to happen by masking people in the schools. It's going to be by masking in the communities. The latest research is now showing that the schools in the U.S. are not leading to increased numbers all over the country. It's the other way around. When community spread gets widespread, that's when we start seeing higher numbers in the school. The only other thing I would comment about is I don't think we're going to have a problem with children in the school district. I do have concerns similar to influenza outbreaks and other ones. It may affect our staff, and we can if 5 kids are missing from one classroom, we can continue to teach the other 15 or 20. But if 5 or 10 teachers are missing from Mr. Harrison's high school back there, that's going to create problems. So the only thing I see us maybe having to pivot down the road in these next few weeks or month or two would be if we have such staff shortages. So I'm certainly in favor of the continued recommendations on this. Any other final comments before we move on? Thank you all. Let's move on to item 6C, which is really the only reason we're here tonight, is we've got Mr. Gockler here from our district mental health coordinator is going to give us a mental health update. It's on electronic pages 10 and 11. Jeff, thank you for being here. We appreciate it.
I think I'm on. Yep. Thank you, Dr. Lund, members of the school board. I also like to thank Dr. Brenner for the invitation and the time to come and provide this update for you on our school mental health system. Like Dr. Lund said, there's a handout in your packet with an overview basically of 10 different programs, initiatives, partnerships that I'd like to highlight today. A few comments prior to that, though. I think it's important that we note, just like everything that you consider and debate as a school board, that there's two sides to every coin, right? And so while we've all experienced the pandemic, I think it's also safe to say we haven't all experienced the pandemic in the same way. So I'd like to start by just recognizing the students, the families, and the staff members who have experienced struggles and challenges, and encourage them to seek support if they haven't already done so. Help seeking is not always easy, and asking for help is actually a sign of strength, not one of weakness. So want to highlight that. To further illustrate, two sides of the coin. Been keeping an eye on all the news, of course, on the national scene about school mental health. Here's some headlines that I've seen recently. The youth mental health crisis is real and teachers can't solve it alone. COVID has harmed kids' mental health and schools are feeling it. The U.S. Surgeon General issues advisory on youth mental health crisis that's further exposed by the COVID-19 pandemic. Now, on the other side of the coin, with challenges come opportunities, and that's also a theme I'd like to speak to tonight. Addressing mental health issues in school leads to improved performance. Schools can help with the youth mental health crisis. Why mental health is the key to dealing with learning loss. So what's it like here in Grand Forks? Just in the last month alone, I visited every single school in the district. I visited with students, I visited with teachers, visited students though. This is concerning. 50% of our students in grades 3 through 12 commented that just in the last week alone, they felt either sad or lonely. Again, that can be a normal human response to something going on in their life, but I think we've seen an increase in these numbers. Some historical data, because I'm going to move into current data that we've seen for students receiving inpatient psychiatric care. A 10-year span from 2005 to 2015, our school district averaged 75 student admissions per year for students receiving inpatient psychiatric care from All True, Red River Behavioral Health, or the Stoddard Center, which of course is no longer open, and Prairie St. John's. Then during a 3-year span from 2016 to 2019, we saw those numbers spike up to about 112 admissions per year. I'll give more current data in just a minute, but first, our mental health staff ratios and how they compare to the national recommendations. Elementary counselors specifically, we have a ratio of close to 400 to 1. The recommendation is 250 to 1. Our school social workers, we've increased significantly over the last 5 years, still have a ratio of over 500 to 1. They're also recommended to be at 250 to 1. Our school psychologists are currently over 1,500 to 1. The recommendation is anywhere from 500 to 1,000, depending on what model a district were to follow. And we're not far off from the national and the state averages there. The national average is 1,200 to 1, the state average is 1,700 to 1. There's a shortage of school psychologists all over the country. Let's flip that coin though, that coin I've been referencing. In the last 3 years, if we count this year included and I project it out, we've seen a decrease in the number of students needing inpatient psychiatric care. My first year out here at the district office in this role, 2019-20, we had 96 admissions. And you'll notice I'm using the term admissions instead of students. For example, that was 76 different students that were admitted a total of 96 times, just to be clear on that. That represented a 14% decrease from those prior years. So that was a step in the right direction. Last year, and we could talk about this in depth for a long time, I'll spare you my additional thoughts for the time being at least, but last year we saw 72 admissions, which was an additional 25% decrease. And this year we're on pace for about that same number. Overall, these 3 years, if we project this year out, would represent about a 30% decrease compared to the 3 years prior. Optimistically, I would like to think that's because of some of our, what I would call upstream prevention efforts, being more proactive. I'd also like to thank Altru for their efforts. It was 3 years ago, or 2.5 years ago, I guess, specifically, that they started their intensive outpatient program for our students. Initially, that was going to be for students 5 and older. Currently, it's for our middle school and high school students. A quick summary of those services. It's 3 hours a day, 3 days a week, 4 weeks in a row. So in essence, it's about 12 half days in a month. The initial year, 2019-20, we had about 24 students participate. Last year, we had about 36 students participate, and we're on pace for about that same number this year. Again, upstream prevention efforts, right? Before they need that inpatient care, let's get them that intensive outpatient care where they're not missing as much school and their symptoms aren't as severe. Further highlights, those students and staff surveys. I think this is encouraging. As overwhelmed and as exhausted as our teachers feel, 90% of them claim they were excited to be at work, 95% recognize it's meaningful work, and 100% recognize their work matters and makes a difference. Our students, I think this is critical, between 80 to 90% of our students from elementary up through high school recognize that they have a supportive friend, an adult in school, and an adult outside of school that's there for them no matter what, right? The importance of support, again, I think is critical. So if you want to take a look at your handout, I'll just do a quick walkthrough and summary of those 10 different items with the goal, recognizing you've got a long agenda tonight and there's additional items after me. I can certainly take questions if you have any. Otherwise, my plan is to provide a more detailed mid-year summary report on our different programs and partnerships, and you can expect that in the next 2 to 3 weeks. So first, the individual services and supports. I mentioned our school-based mental health professionals. We've got over 50 between school counselors, social workers, psychologists. In addition, there's about 8 of us that are considered what I would call mental health specialists. Myself, we've got 3 mental health specialists at the Mentor Center. We've got a substance abuse counselor. We've got 2 therapists. We've got a mental health coordinator at Head Start. And like I said, the district has, thanks to you and our district administration, utilized our Title IV dollars, our ESSER funds, additional grant money. We've also partnered with different entities, CVIC and Altru, to help with some of these staffing. And we'll see another increase next year. North Dakota legislators passed a bill now requiring a ratio of 300 elementary students per elementary counselor. That goes into effect next fall. Those positions are already posted. Our referral sources, our school counselors and social workers are in the process of utilizing a therapy prioritization rubric as we've increased school-based mental health services to best determine which students should receive those services. So based on a need for transportation, financial assistance. So for example, you see a few partners listed there: Village, Birchwood, Together Counseling, and then UND. Village, we just started those services here within the last month or two, and we're targeting our elementary students, specifically students that have experienced foster care, have experienced homelessness, our new American population, and then also families with a need for financial assistance. So we've got 4 different therapists going in to our elementary schools just from the Village alone. Birchwood provides school-based mental health services up through our high schools. Together Counseling is based out of Fargo and provide telehealth services. And then UND, we've had an existing partnership with them for our Access for All scholarship, where families can ask for a referral from our school-based folks and receive counseling services for free if there's a need out at the Northern Prairie Community Clinic. And then this year, we're also piloting a new program at Viking Elementary, where under the supervision of a faculty member from UND, we've got doctoral students providing services right there at Viking. So again, trying to increase those school-based services. We're currently in the process of hiring 2 therapists to go into our elementary and middle schools for students who are part of our self-contained programs for students with an emotional disorder. And we're excited about the prospect of getting those professionals in the schools too. Next is the group interventions. It says there NPCC, again, that's the Northern Prairie Community Clinic based out of the old UND Med School. They're now providing group therapy that took some additional funds to provide that service, and luckily we were able to find a donor in the community who made a donation in honor of their son to allow those services to start. Additionally here, about a year and a half ago, we have, over the past, I would say, 1.5 to 2 years, we've trained nearly 3 dozen counselors, social workers, and school psychologists in evidence-based group trauma interventions. And those are services that are being provided in the schools now too. Some in partnership with therapists from CVIC. And I'll put it this way. To quote one of our social workers who's partnering with CVIC and providing this service to her students, she said, "This is life-changing." They've got families that are coming to them and begging for these services now because they've seen the change in their children. So we've got kids that did not want to go to school before that now recognize that they can get help. They're seeing a benefit to working through their trauma. And I just can't say enough about these interventions, Bounce Back and CBITS. Moving on, trying to be conscious of time here. Next, I think many of you are familiar with this program, Sources of Strength. You might be primarily familiar with it, though, at the middle school and high school level, where it's a program. We were one of the first districts in the United States to roll that out district-wide at the elementary level. We piloted that 2 years ago at Century. Last year, we implemented that in grades 3, 4, and 5. This year, we again are at the front of the pack, first districts in the country to pilot at the kindergarten level. I spent some time in a kindergarten classroom over at Kelly Elementary today. It was amazing watching that school counselor talk about brain development with 5-year-olds. And they ate it up. It was a thing to behold. It was wonderful. Lots of things happening there. We partnered with the University of North Carolina last year to do research on the impact of our implementation. So we understand the benefits of this program. We're offering coaching classes for any staff that are interested in an after-school virtual professional development setting, so that they can incorporate Sources of Strength in their own personal lives and then better understand how to utilize that in their work with kids. Just this year alone, we've trained over 150 new peer leaders at the middle school. That basically means they've gone through a 4-hour training to be on the front lines of helping their friends know when to seek adult help. Doesn't mean we're turning them into junior counselors and psychologists. It's not their job, it's not their role, but how to help them seek that adult help when it's needed. And then pretty soon those peer leaders are going to be building and distributing grief kits, because if there's one thing I've seen over the last few years in this position, it's the impact of loss. And that goes for students and staff. I get calls frequently on resources to help, again, students and adults deal with grief, deal with their loss. So we're putting together grief kits, and then those Sources of Strength peer leaders will be on the front lines of putting those together and helping to distribute those across our campuses. Next item on your handout is Calm Classroom. That's a mindfulness program that we began training on last year. It can be implemented in any room, at any level, with any number of students. Last year, we had between 150 and 200 staff participate in that training. They took an e-learning course. They took 4 months of training, and I think what they appreciated about it was the ease of implementation. As little as 3 minutes per technique, in as little as 1 to 3 techniques per day. So anywhere from 3 to 9 minutes a day. Here's the benefit that they saw at the end of the year survey. Here we go. 97% of the students seemed calmer and more peaceful after practicing Calm Classroom. 95% of the students were more engaged and ready to learn. 90% of the students said they actually enjoyed practicing mindfulness. From the teacher perspective, 98% of the participating teachers said they were able to manage their own stress more effectively, and close to 90% of the teachers were actually utilizing it outside of work hours on their own. So we'll do that training again here. Actually, I think just last week, we started a new batch of, I think, close to 125 teachers starting their e-learning course on mindfulness. Moving down the line here. Panorama. You may be familiar with this on some level. We piloted that last year with some North Dakota behavioral health grant dollars. This year we've utilized ESSER dollars for this platform. And basically it gives us the ability to utilize surveys for students and staff. You heard me reference some of those earlier. Basically what it is, it's self-assessment in the areas of social emotional skills, supports, and just general overall well-being. But in addition to those surveys that come out of Harvard Graduate School of Education and John Hopkins University, it allows our teachers to see a dashboard, and it puts on that dashboard not just their academics, their behavior, their attendance, but it incorporates also their social emotional learning assessment, and then it allows our teachers to have a tool to communicate about which students need interventions and what type of interventions. It's a pretty dynamic platform, and I'd say we're just scratching the surface, trying to get some additional training, get people up to speed on the power of this platform. Next is Bibliotherapy. It's a project that we've used some grant funds for, and I think it lists, a number of the topics that we found resources on, close to 1,500 books that we got into our school libraries last year. Worked with the library media specialists, the counselors, the social workers, to try and get those books in the hands of kids that need them. And quite frequently I get sent pictures of the students just consuming these books. And it's fun to see. It's a chance for the students to learn the importance of self-help, right? That they don't just have to be dependent on waiting for a counseling appointment or waiting to talk it over with an adult. Some of these things they can process on their own or with some guidance. So you see there some of the topics. Anxiety, self-esteem, resiliency, mindfulness, and again, some serious issues as well. Anxiety, depression, self-harm, positive mental health, and other disorders. We've got an additional grant this year to grow that project, and part of what we're trying to do is reduce the stigma. So it's how we present those resources. So we've got some custom signage in all of the libraries across the district called Stories of Strength, and trying to help students understand that, again, they grow stronger by working through their challenges. All right, next. The S3 Learning Collaborative. So S3 stands for Safe Supportive Schools, and I'm excited. Hopefully you've seen this announced previously, but we were one of 15 districts selected across the country to participate. Basically what that allows us to do is receive 2 years worth of training from school mental health leaders across the country. Each of these 15 districts is assigned a faculty lead. Our faculty lead, I meet with her again tomorrow. She meets with me monthly, and then she meets with our team monthly, and our team attends a virtual learning session each month. And then basically what we need to do is provide 6 hours of training this year and next year to our 2 participating schools. So each of those 15 districts was asked to include 2 schools. So our participating schools are Lake Agassiz and South, and they each have team members. So for example, Dr. Schleicher and Tana Thorfinson from South and then Angie Jonason and Elisa Bowman from Lake Agassiz. We've got 4 other district representatives, and then 4 community and state level partners. And the 12 of us go through this training, pass that training on then to those staff. So I think next month we're spending 4 hours training those 2 schools, upwards of about 150 people on topics such as trauma and adversity, with the idea that then we'll learn from that and optimistically expand that into the other schools in the future. Speaking of professional development, the state has Senate Bill 2265, which requires 8 hours of professional development every 2 years for all school districts in North Dakota, specific to topics of mental health. In our district, our staff receives a minimum of 10 hours every 2 years. We hold suicide prevention training for an hour every fall. We have a train the trainer model in place where we bring together about 70 or 80 people every quarter. Those folks go back to their schools, train their staff, and again, social emotional learning, mental health topics such as self-awareness, relationship skills, stress management, responsible decision making. Other professional development opportunities over the last couple years. Well-being information and strategies for educators, educator support groups. We've run youth mental health first aid. We offered trauma-informed care and practices to all of our paraprofessionals. We offered a class in partnership with CVIC on building resiliency. Also trying to take special note of what supports we can have in place for our staff. So this year we utilized grant funds to partner with Together Counseling out of Fargo. And this is available to both students and staff. And it's actually not traditional outpatient therapy, but each student and staff member that chooses to participate can receive up to 10 half-hour sessions focused on coping skills, stress management, just daily life, basically. Our staff can utilize that during a planning period or after work hours. And that just rolled out here about a month before the Christmas break. So I know for a fact we've got students and staff already participating, and those that have already seen a benefit, and I hope those numbers continue to grow. Again, trying to really promote the idea of help seeking. Lastly is our off-campus supports. I think everyone here is likely familiar with the STEP program. It was about 2.5 years ago that in partnership with CVIC, we were able to place a full-time therapist within the STEP program. And that's basically worked well enough that that's what we're modeling, those other 2 therapist positions that we're looking to embed into our elementary and middle schools. I mentioned the mental health and SEL specialists that are at the Mentor Center. In addition to that, I frequently head over to the Mentor Center and provide training to their entire staff, not just their mental health specialists, and just continue to see the benefits of the students and families utilizing the Mentor Center. And then lastly, I'm sure you'll hear more about this as we go. We're in the very early stages of planning for a setting that would provide some additional support to our elementary and middle school students that are in need of a more therapeutic setting to focus on their mental health needs so they can get back to focusing primarily on the academics. But hopefully I did okay on time. Rattled that all off pretty fast. If you've got questions, I'm more than happy to field them. Otherwise, like I said, we'll do my best to get that mid-year report with more specifics to you in the next 2 to 3 weeks.
Thank you, Mr. Gockler. Any clarifying questions or comments from board members in the room? Go ahead, Jackie.
I don't know how you'd ever track this, and maybe you do, but I think it'd be interesting to see how many instructional hours aren't occurring due to mental health. I think that'd be interesting. We can talk about inpatient, but I think there's some kids who maybe don't reach the threshold of an inpatient, but miss a lot of school, right? So it'd be interesting to know those kinds of things. And I'm also just here to voice my support. More social workers, more counselors, I'm all for it, as we can be able to provide that as a district.
Further clarifying questions or comments? Shannon, any comments or questions?
No, I just think it's exceptional work he's doing. Thank you.
Thank you, Shannon. Cynthia, any questions or comments?
I guess I had two. One was, I know, Jeff, you've mentioned addiction as a concern. Where does that fit in on that handout? Like, where do you put that within the handout? Are you focusing at certain schools on that? Are you focusing at the high school level more than, say, at the middle school level?
My wife would be the first to tell you that I don't hear exceptionally well. I think, did she ask about addiction?
Yeah, and she was wondering where it was on the sheet, and then also, where are you focusing? Are you focusing high school level, middle school level, elementary level?
Sure. So we hired Cindy McMillan, our substance abuse counselor, approximately 4 years ago, I believe. The majority of her work is focused at the high school level. Red River Central and Community High School, I know she does go down and provide some support kind of on an as-needed, when-needed, if-needed basis to the middle schools. She does a lot of individual work, but also has started getting into, some of the health classrooms, doing some presentations school-wide maybe. And basically I have that, Cynthia, listed. I don't spell her out specifically, but under that first item, individual services and supports, the 50-plus unified mental health team members, she would certainly be considered one of our mental health team members.
Cynthia,
So what's the recommendation for a school district with regards to addiction counselors?
Sure. To be honest with you, I don't know a specific ratio there. I can tell you that to the best of my knowledge, when we hired her, and again, this is just to the best of my knowledge, I believe we're the first school district in the state of North Dakota to have someone on staff full-time in a position like that, so.
any further questions or comments? Thank you, appreciate it. The update was great, thank you.
Thank you.
Let's move on to item 6D, a financial committee report on electronic page 12. Doug?
Yes, Finance Committee met on December 16th. Had a presentation from Chris Arnold laying out potential spending of the ESSER dollars, of which you'll see a request by administration later for action for those ESSER dollars, and also what to do with the new 10 mil building fund levy that we have, that $2.5 million, and how that should be allocated and spent. We spent a significant amount of time discussing that and talking about it, and the potential of taking off a piece of that revenue stream, approximately $1 million, I think was really the kind of the number we talked about, and bonding with that $1 million to generate $8 or $9 million available then for a larger project, so that we could concentrate and proactively use that to deal with issues, and leave the other remaining $1.5 million more for emergency and as things came up to be able to respond to things that we know are going to happen. We just don't know what they are and how much they're going to cost. So that was the discussion. There was no formal action taken on that. But I think at the next finance, we probably will be looking at that, because I do think we need to take action pretty quickly to give Mr. Arnold the opportunity to plan out a plan of work and to go through the whole bond issue process. We also spent some significant time talking about Valley and Schrader middle schools, and I think the consensus clearly was that we need to do something very quickly with Valley, which probably entails a bond issue. We also had significant discussion that maybe as part of that, we should also have an additional question or portion of that for approximately $20 million for needs at Schrader Middle School as well. No consensus necessarily on that, but clearly Valley, it needs to happen soon. We need to have that discussion and make that decision if we're going to put something on the June ballot. And there needs to probably be discussion of should that be larger and include something for Schrader to address the significant concerns in the older part of that building. So again, we'll need finance committee meeting to have further, and actually probably should have a facilities committee meeting to discuss that matter of Valley and Schrader. And if the facilities wants to have input to the finance committee on the bonding, that could be appropriate too, but that's something that needs to happen anyway. Finance at least will have to meet to talk about the bonding of a portion of that construction fund or building fund. And facilities would need to be involved to discuss a ballot question. So we need to keep that progressing along with our other budget concerns and issues. So that really is what we discussed. No specific motions came out of it, though the ESSER $3 for facilities will come up later in the agenda. Any questions or?
Now that we have a finalized guiding change document, I think that'll probably help not only the board, but also the committee with the guidelines of things. I would suspect that'll be helpful to them.
Bill, I don't know if, Bill, you had anything to add, or Shannon was also there, if she had anything to add.
Shannon, anything to add besides what Doug presented?
No, Doug covered it.
Other board members, questions or comments to the committee? Thank you. To be continued. Thank you. Let's move on to item 6E, Athletic Department restructure on pages 13 through 26 of the electronic packet. Dr. Brenner.
Thank you, Dr. Lund. Hopefully you had some time to read this and digest this information since we sent it out last Thursday. So I'm just going to take you through paragraph by paragraph so I don't get ahead of myself on any of the information. So here we go. For much of this school year, HR Director Lindsay Stodstead, Associate Superintendent Catherine Galach, and I have been working through a process to restructure the district's athletic department in an effort to move the overall supervision of coaches, assistant coaches, student athletes, and teams closer to those constituents, which we believe is a better service model. The three of us met with District Athletics Director Dr. Mark Rarick this past summer to share with him that this year would be the final year of his district-level position that will dissolve, as it will dissolve June 30th, 2022, and the vision was to stand up high school athletic director positions at each of the two large high schools, which we presently don't have. This restructuring is not to be construed as a budget reduction, but rather, as previously indicated, a better model to provide leadership and support at the high school level. Throughout this process, over several months, Ms. Sosted, Ms. Galach, and I met with high school principals almost on a weekly basis, invited coaches to the table to be part of the conversation, and responded to a request from the Coaches Council to meet with them, and brought in middle-level leadership representation to discuss the concept of an athletic director at each high school in concert with the elimination of the district-level athletic director position and the elimination of the middle school activities director position at the conclusion of the school year. We've enlisted the experiences and athletic departments of other school districts as well, and we have listened to internal stakeholder feedback. What we've learned in this fluid process is there continues to be a desire from internal stakeholder groups to have a central office position that will ensure equity between and among high school and middle school campuses. As a result of the aforementioned, we've landed on a new structure that would include the following: a district activities director. This position replaces the district athletic director position and will be responsible for maintaining the overall vision and equity between Central and Red River High Schools, as well as our middle schools, Schrader, South Valley, and Twining, when scheduling games, practices, activities, and supporting resources in coordination with the new high school athletic director positions. The district level position will be responsible for representing the district at statewide, national level and executing logistics associated with locally hosted regional and state tournaments. This position will oversee all North Dakota High School Activities Association competitive activities that are integral components to our overall student experiences, and would be responsible for developing and leading training for coaches, assistant coaches, and advisors involved with NDSHAA programs. Middle school athletic scheduling, programming, and event organization, as well as elementary intramural contracts would be the responsibility of this new position. This position will be supervised by Ms. Galach, and the district activities director will collaborate with and supervise building athletic directors at each of the two large high schools. Dr. Rarick has the option to apply for the new district activities director position and either of the high school athletic director positions. The present administrative assistant to Dr. Rarick will continue in her role here at MSEC. The next two positions, high school athletic director. The current high school activities director positions, there's one at each school, Central and also Red River, would be dissolved and elevated as high school athletic directors. One position will be at Central while the other's at Red River. This new role will be responsible for the hiring, supervision, development, and evaluation of high school level coaches and assistant coaches, will assist in building school pride, participation, and capacity in high school athletic programs. These positions will communicate and coordinate with each other and with the district activities director in order to support the district's athletic teams and students. This new role will take a quote-unquote boots-on-the-ground approach to supporting coaches, assistant coaches, student athletes, and teams. They will also play a critical role in the growth and development of our student athletes and coaches. The duties of the former high school activities directors, and I know this gets a little confusing because we're eliminating that title at the building level, but we're creating the new title at the district level. Student leadership activities, duties at Central and Red River High School will be designated to existing teachers or staff to be compensated, similar to a 6/5 contract. Their teaching schedule will include an every other day student leadership class and an every other day prep period to provide time for student leadership activities and responsibilities. In addition to the one regular prep period daily, they will have their regular free period daily. The current employees in the high school activities director roles will be reassigned to teaching positions, and they have the option of applying for any of the three restructured positions. The current middle school activities director role, which is half-time here at central office, will be absorbed into the new district level activities director role. The current employee in this role will be reassigned into a full-time teaching position, and this person too has the option of applying for any of the restructured positions. The athletics assistant will remain intact to provide support to the activities director as well as the high school level athletic directors as needed. Additional training around alternative methods of operations will be provided in order to update processes and procedures. On the top of page 15, now we move into the job descriptions and the timeline of what we're proposing moving forward. So let's just go right to the timeline. The week of January 17th, which is next week, the new district activities director job would be posted internally and externally through January 31st. Interviews would be held the week of February 7th, with a recommendation coming to this body on February 14th. Following that, the week of January 31st, the high school athletics director positions will be advertised internally and externally through February 14th. Interviews would be held the week of February 21, with those two candidate recommendations coming to the board on February 28th. Hired candidates, along with Ms. Galach, will then begin planning and organizing for the 2022-23 school year, athletics and activities, alongside those in existing roles for successful onboarding and transition to be completed by June 30th of 2022. So what you have attached to this is the Grand Forks Public Schools Athletics realignment, kind of a status update. Basically, there's a lot of redundancy in my memo and with the next document. Then following that, you'll see the original, the present current athletics structure, and then what the new athletic structure would be, you can find on page 19. So that is for your review as well. And then one of the biggest questions probably board members have is, okay, what's the cost associated with this? The first thing I would say is the cost associated with this is going back to the purpose. And the purpose of the realignment is to get is to get our administrative support athletic directors at the campus level, again, to support our coaches, student athletes, and teams. So under our present structure on page 20, you can see that the overall cost of paying people in these positions is slightly over $371,000. In our new structure, the cost goes up by just shy of $22,000 in this new structure. So while we're not in a tremendous position to be adding costs to our overall budget, we believe there's strong alignment for the vision of how we'd like to see our high school athletics and activities carried out with this new model. Following that, you'll see the job description on page 21 for the district activities director. And following that page is the job description for the high school athletics director. Again, one at each school. This really, this model brings us more in alignment with what other comparable size school districts have in place. Probably the apprehension or the nervousness in moving to this is we do have strong activities director folks at the building level who do phenomenal things with student leadership. And we wanted to make sure, and certainly I would speak on behalf of high school principals, want to ensure that that piece is not eroded, because that's something special and unique to Grand Forks that other schools and other school districts do not have. So that's why we're instituting that 6/5 contract that would be attached to a teacher's load at both of the high schools. And so by bringing this to you early, we have time to go through the processes that I've already illustrated, and that we'll have ample time to onboard people and transition all of these positions successfully. If you're wondering if why this is under discussion and not under action, the last time I brought a restructure to you was our curriculum instruction assessment and professional development department merging with technology. And that was what we would call management or operations, and we brought that to you as information and not suggesting or recommending that you take action on that. But having said all of that, we're certainly poised to respond to questions, concerns, have you thought of, and Ms. Galach and Ms. Dotstead are here to respond to those questions along with me.
Thank you, Dr. Brenner. Board members clarifying questions or comments? Cynthia, do you have any questions or comments?
Yeah, I don't really understand. What I worry about is that then are you going to be coming back, is the district going to be coming back to the board and saying, all right, now we have this $22,000 additional to the athletics, so we have to find $22,000 to reduce in another area. That's one question, just in terms of cost, because we would be getting this. It's good that it's for discussion and not for action. But we've gotten this, but we don't know any of the other plans for the district. And then I don't have enough understanding of why the need for high school athletics directors, one at Central and one at Red River, at $105,000, in addition to a district activities director at $114,000. So those are my questions. Sorry to be blunt.
No, that's a fair question. The salaries, Cynthia, and the rest of board members are median average ranges, so they could be lower, they could be higher, depending on the people who are selected for those positions. Ms. Dotstead did a market study using comps of other school districts our size in North Dakota, and that's where the salary ranges came from. I tried to answer both questions in one response. Cynthia, did that respond to your question?
So the other question is, why do we need this? I read your memo several times, actually. Why do we need an athletics director at Central and at Red River in addition to this district activities director?
The positions at the high schools are going to be able to, they're more able to be closer to our coaches, to our student athletes, to our teams, for supervision, evaluation. That's a large piece of the portfolio that would move from central office, coaches, supervision, and evaluation, right to the campus level. And we believe that will better serve our coaches. As a matter of fact, when we met with coaches, that was certainly alluded to, that they would appreciate having that kind of visibility at the building level.
Then my other question was, in the longer term, this is an additional, under what, 28,000, you know, then are you going to be coming to us saying, well, now we need to cut 28,000 in, I'll just use what I used all the time, music or art?
No, we will not.
I mean, we are going to have to make budget cuts, I'm assuming.
Well, our guiding change document is going to help us with that process. To my points earlier, Cynthia, we'll be bringing scenarios to the board for consideration that has to do with the budget realignment process. So once we work those first conversations through Finance Committee back to the board, what's that target number going to be, and what's that in the realignment process, how much time would the board like to give district leadership to accomplish those pieces? Is it going to be 1 year, 2, 3, or 4 school years? That will determine, what kind of scenarios we would bring to the board.
Okay, thank you. And then, you've got student council and leadership, the 6/5 contract. Would those then be part of the negotiated agreement?
Well, the 6/5 pieces are in the negotiated agreement, so principals will have a role in hiring, seeking out, hiring, selecting people at their building level who would best serve in those roles.
So can you explain who does that now?
Yes, at Red River it would be Tyler Nelson, and at Central High School it would be Aaron Ledoux.
Shannon, do you have any clarifying comments or questions?
I have a question at the district level, the add back in of the activities director. Those roles and responsibilities, are those a full FTE? I was curious why, or if it was considered having the two designated athletic directors at either Central or Red River rotate those statewide, national-wide representation roles?
Yeah, that's a really good question, because the initial work that we were doing, we were really thinking that the central office position would be eliminated entirely, and we would just stand up a high school athletic director at each of the campuses in the absence of anything in central office. And so working those conversations through our high school principals, our middle school leadership designee, along with our coaches, the feedback that we heard was, it's pretty necessary to still have this central office position to ensure equity. And by the way, the district activities director now has all things High School Activity Association under the umbrella of that position, not just athletics. So it's a bit like the Fargo model, but probably not as expensive as the Fargo model.
Okay, thank you.
Any other? Go ahead, Doug.
Couple of things. We eliminate the activities director at the middle school. What was some of the responsibilities of the middle school activities director? And was hiring coaches part of it at the middle school level? Who does that?
Our associate principals at the middle school level serve as the individual ADs for each building, but they're supported by the activities assistant. Currently serving that role is Brian Halverson. And so the key factors of that position are primarily logistics. So scheduling games, organizing buses, officials, hosting coaches' meetings at the start and the end of the year, that sort of thing. And so that portfolio would roll under the district level position. It would allow for alignment, for potential look at aligning the visions, the services as they go throughout the system that way as well. So
And so the assistant principals keep the coaches?
they will continue in their roles at the building level.
One thing, and I know I mentioned to you earlier why I was surprised that there was an increase in cost. I think you got an error in your spreadsheet. If you look under current structure, activities director middle school, under the salary, it's $80,848. Then I don't know what the $10,207 is, but then you got $50,631 over in your total column. And if,
Yep, I can speak to that. I believe and I'm struggling to find that page, but the person
Page
serving that position currently teaches part-time and is .4 as far as the athletics director or activities at the middle level goes. And so that's proportionally the teaching position versus the athletics part of it.
so in reality, it's the 50,000, it's just, you've got 80 and, okay. I think that's not a very clear way of expressing it without some kind of, something that indicates that. What is that column that's 5,000, 13,154, 65, 12,290, 65? What is that?
I'm going to ask Ms. Stadstead to come to the microphone because she has the details behind that.
Thank you, President Lund, members of the school board. Mr. Carpenter, what's your question?
That column that's on this cost structure, that starts out with the athletic director, I assume the 136,385 is salary.
Yes.
And the 5,000, what's the 5,000?
Oh, yep, I'm sorry, that isn't labeled very well. So that would be for like the athletics director, that's additional dollars given towards education. So that would be the doctorate. And then moving down that for the Red River and Central activities director, that's additional stipends for various things. So that's just additional salary that's paid on top of their annual wages. Does that make sense?
Okay. Why do they have additional stipends for different things?
Various things such as like yearbook or, what's another one that they have?
Yeah, folded in as the event supervision,
Yes.
all the extra hours that they have on top of it. I think the list is really pretty lengthy.
So I assume that's why it's significantly less when it's now going to be a high school activities director. Most of it's rolled into the position? Or is that? just-
Yeah, in the bottom column, sorry to cut you off, Lindsay, that is solely based on education factor, but you're correct, all those extra stipends and responsibilities are absorbed in the position itself.
Okay.
With the exception of the student council piece that was mentioned by Dr. Brenner.
Okay. I am still disappointed that this is going to cost us more. I mean, it may be a better model, but when we have budget issues to spend even $22,000 more, doesn't make me very happy, so.
And I still wonder if the math was wrong on the above one and they're actually 40,000 off. Because I still think, Lindsay, can you respond to that? The activities director at the middle school level, what those numbers mean?
Yep. Thank you, President Lund. So those numbers, so the activities director at the middle school at $80,848, that's his salary entirely. But what to Ms. Glatch's point is that some of that's allocated to the athletic director and some of that's allocated to a teaching allocation. So instead of reflecting the whole 100% of that salary, that wouldn't be reflective, or that wouldn't be the right amount to reflect for this spreadsheet.
So those total numbers are correct?
Yep.
Okay, thank you. Other questions or comments from board members? Mr. Douthit?
Thank you, President Lund. I know when this was proposed, I do recognize that the district level position was considered to not be part of the overall end result. And I certainly had my concerns with that. And I also have had multiple conversations with principals in other districts, athletic directors in other districts, school board members, West Fargo. And as I have said, and I've spoken to senior leaders here, the Dr. Brenner, Ms. Galach, Ms. Stadstead, and in those conversations, you know, had my concerns and things. Yet at the end, what I said is, we as a board, we as a board are to be at 5,000 to 10,000 feet. Respect the decision-making of senior leadership. Accept their wisdom. And so what I'm saying is, this is very difficult, and it's very challenging, and I will say it's emotional. And the conclusion I have come to is that I'm going to stay at 10,000 feet. I'll respect their leadership, and hopefully, as far as the funding piece is, that the accuracy is there.
Thank you. Seeing no further hands up, we will move on to recommendations for action under 7A, consent agenda on electronic pages 27 through 32. Do I have a motion and a second for consent agenda? Motion by Jackie and second by Doug. Assuming a roll call vote, all those in favor, please state aye. Aye.
Aye.
Opposed, same sign. Motion carries. Let's move on to item 7B, which is Student Transportation Services Agreement on electronic pages 33 through 71. Mr. Berge.
Thank you, President Lund. I'll walk through the agreement at a high level, as again, there's about 40 pages here. The Student Transportation Services Agreement between the school district and Dietrich's of Grand Forks expired June 30th of 2021. A request for proposals for transportation services was advertised. Dietrich's of Grand Forks was the sole respondent to that request for proposal. The district engaged Watson Consulting to assess transportation plans, costs, options, and to assist in obtaining a new contract for the district student transportation services, or potentially complete a transition to a district provided bus service where the district would take on busing itself. Watson Consulting also assisted the district with the previous transportation agreement in 2014. Watson Consulting's memorandum is attached within your board packet. The administrative recommendation is to approve the student transportation services agreement with Dietrich's of Grand Forks for 2 contract years, commencing July 1st, 2021 and ending June 30th of 2023. An option to extend for an additional 5 years, ending June 30th of 2028, consistent with North Dakota Century Code. And along with the following findings that Watson Consulting brought forth to us based on their work. You can see on the next page, the Watson Consulting memorandum. The first year of the agreement, or the school year that we're in, the various groups of bus routes, the average increase is about 2.75%. The city routes are about 3.57% increase. For year 2, that would be at 2.5% across the board for the 22 to 23 school year. If I flip you forward to page 36, there we get into the actual services agreement. Again, the term, thus forth here would commence 2021 and end June 30th of 2023. Again, with an extension of term if both parties agree to such an extension. Page 37 is gets into the different types of routes. So for example, Group 1 is the Air Force Base route. Group 2 are the regular city routes. Group 3 are the special education routes. Group 4 activities, and Group 5 shuttles. Continuing on, let me see here. There's a provision on page 38, for Dietrich to increase, their hourly rate of pay and hopes to become fully staffed and to be able to provide all routes. As you know, right now, the City Area Transit is assisting us with both equipment on their regular city area transit routes, as well as actually driving. Some of the city area transit drivers are driving Dietrich buses. We're hopeful Dietrich will be able to staff up and provide all routes. One new thing within the contract would be on page 39, the bottom of 39, is a contractor annual service plan. That spells out a variety of items that would be completed by August 1st of each year, such as identifying all of the routes, the list of drivers, the students assigned to each route, et cetera. You can read all of those line items. Another item to point out under section 9 on the same page, or on page 40, is liquidated damages for noncompliance. And so you can see various provisions for 1/2 of a daily route for various items, up to twice the daily route on page 41. Under C, bullet point 3, failure to provide a bus for a route or bus service due to lack of drivers or equipment would then potentially be cost Dietrich twice the normal daily rate as a provision. And so we're hopeful with these various provisions going into next school year, in particular, that Dietrich becomes fully staffed. And in the work that we do with them, and some potential with the city, we've talked about some potential for a joint powers agreement type of a situation with fuel costs or sharing drivers or mechanics or things of that nature. So there might be some other things that we bring forth, given the staffing shortages that of course we're seeing nationwide, not only in transportation but even within our own school district. Of course, I'm probably getting into the weeds here a little bit. You hit page 44. That's the various group type of routes. Again, the cost per day, per half a day, and additional time, etc. That's a similar schedule as to what you've seen in previous years. And then we hit Exhibit B on 47. Actually, the pages beyond that really relate to the request for proposal that Dietrich did respond to, and thus significant portions of that became part of the services agreement that you have in front of you. So that in a brief overview of 40 pages is the work that's gone on, to work towards an agreement with Dietrich for student transportation services for our school year that we're in, as well as the school year of 2022 to 23.
So in a big nutshell, that's what it is. And on electronic page 35 is the recommended motion. I'll open it up for people who have clarifying questions or comments. Shannon or Cynthia, do either of you have any questions or comments?
No.
No, my only comment is, I just know that without the city helping, it would have been very hard to do transportation this year.
I think we all are in complete agreement with that, and thank your city workers for the hard work they've done. So, any other questions or comments? If not, I would entertain a motion. Motion by Doug to approve.
I'll move the motion as laid out on page 35 of the electronic packet.
Do we have a second? Second by Bill. Any further questions or comments? Seeing none, assuming a roll call vote, all those in favor, please state aye.
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 Opposed, same sign. Motion carries. Thank you. Let's move on to item 7C, which is the joint powers agreement with Grand Forks County for election services. Electronic pages 72 through 75. Mr. Berge.
Thank you. I'll read briefly through the memo, and that really is a summary of the subsequent pages. It attaches, and this is not something new in past election years. There's been a joint powers agreement with the county of Grand Forks. There are some differences which I'll highlight. And so attached, of course, is the proposed joint powers agreement with Grand Forks County regarding the provision for election services. This is a new item that the agreement automatically renews for an annual term commencing on the first day of January and ending on the 31st of December, unless any of the parties notify the other parties in writing of its intentions to withdraw. So this will be an item that renews. Administrative recommendation is to approve the joint powers agreement as laid out. On page, I'll point out on page 74, in the past there were some costs split between the city and county and park district along with the school district. Under number 4, letter B, the county shall pay all costs associated with elections and canvassing for joint elections. That would be like the June primary elections and the November presidential election. C and D layout. For example, obviously we had 2 special elections in last year, and so if the county administers a special election for the city, or in our case, of course, the school district, all costs are the responsibility of the district in that situation. But it is slightly different that in the general election, there won't be in the past it's been an $8,000 cost that's been passed through. Beyond that, it's a similar agreement as before, and again, this will be automatically renewing unless at some point in time the school board and administration decided that wasn't needed to be modified for any particular reasons.
Any clarifying questions or comments? Seeing and hearing none, do we have a motion to approve the joint powers agreement? Motion by Jeff and a second by Chris. Assuming a roll call vote, all those in favor, please state aye.
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 Opposed, same sign. Motion carries. Let's move on to item 7D, which is policy review, which is on electronic pages 76 through 113. Cynthia, are you going to take this, or do you want me to do it?
I can do it if you can hear me.
We can hear you good, thank you.
Okay, so this is fairly straightforward. These are all policies that we've looked at. It's their second reading as written and amended, and we are looking for adoption of the following policies: ABAB, school year and calendar; ABBDA, political activities; displays of religious objects or documents; use of animals in district schools and in curricular programs; school medication program; naloxone administration; do not resuscitate; vandalism; staff code of conduct; teacher discharge for cause; and fair entrance requirements as amended. I make a motion to approve.
We have a motion. Do we have a second? We have a second by Jeff. Any further questions or comments for Cynthia? Seeing none, assuming a roll call vote, all those in favor, please state aye. Aye. Opposed, same sign.
Aye.
Opposed, same sign. Motion carries. Back to you, Cynthia.
Thank you. The next are to rescind. These are policies that we need to rescind because we are adopting the preceding the policies. So policy 1001, district calendar, replaced by ABA, and administering medication to students has been replaced tonight as well. Vandalism, we've replaced, and early entrance requirements, age of attendance, kindergarten age fees, first grade age, etc., replaced tonight as well. I'd make a motion to rescind those policies.
There's a motion. Do we have a second? Second by Jeff. Any further questions or comments? Assuming a roll call vote, all those in favor, please state aye.
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 Opposed, same sign. Motion carries. Back to you, Cynthia.
Let's see, do we need to make a motion on the required reading and adoption of the complementary board regulation?
Yeah, the naloxone one we do.
Okay, so, sorry, my iPad is calling at the same time, which is very distracting. I believe that's it then, right? So I'd recommend that we adopt the complementary board regulation for naloxone.
Did you recommend or make a motion?
Oh, sorry, I recommend it. I'll make a motion to accept.
Thank you. Do we have a second? Second by Jackie. Any questions or comments? Seeing none, assuming a roll call vote, all those in favor, please state aye. Aye. Opposed, same sign. Motion carries. Thank you, Cynthia. Hope you feel better. Let's move on to item 7D, which is approval of formation of agency selection committee for Career Impact Academy CMAR delivery process. Mr. Arnold.
All right, President Lund, board members, on page 114 of 148, there is a memorandum providing clarification from a comment that came up during the last board meeting in regards to the CMAR delivery process and the approvals required. You read through the memo, the selection process for construction management at risk planning, design, and phase services, the governing body, which is the Grand Forks School District Number 1 School Board, shall form a selection committee when utilizing the CMAR delivery process. North Dakota Century Code specifically calls out those positions, and they are as follows: an administrative individual from the governing body, a registered architect, a registered engineer, and a licensed contractor. It is the administrative recommendation to allow administration to form this agency selection committee and further press ahead in the CMAR delivery process.
Thank you. Mr. Carpenter, thank you for bringing this to our attention last time. Two quick questions. Do we have to have the actual names of the people on there, just the titles? And then what does CHFM mean behind your name?
That means, oh my goodness, Certified Health Facility Manager.
Thank you.
Where did that come? Is that on the memo?
It's at the top. It's behind your name there. It's in some color I don't recognize. It's in some color I don't recognize. So,
all right.
any other clarifying questions or comments from board members? We got a motion to approve the recommendation by Mr. Carpenter. We have a second by Mr. Douthit. Assuming a roll call vote, all those in favor, please state aye.
Aye.
Aye. Opposed, same sign. Motion carries. Let's move on to item F, which is approval of ESSER 3 facilities expenditure. On page 115, Mr. Arnold, CHFM.
All right, let's move on here. The next topic is ESSER 3 funds. As the memo states, we have approximately $4 million remaining in construction designated ESSER 3 funds. In accordance with federal, state program guidelines, which are CARES/ESSER guidelines coming to us from both the federal and the state level, we need to provide some detailed information. We also are required to provide school board approval, which we will further move forward up to the state for them to also approve so we can utilize the ESSER 3 funds. Probably should just backtrack just a moment. The reason why you haven't seen this before is because it has taken the state quite a while to actually formulate this path, and we have now, they've kind of given us the final direction. Does that that correct, Scott? I just want to make sure I'm saying that.
Right. And so with the ESSER funds, they're on a reimbursement basis. Now with any new work that school districts do, the state requires a form to be, completed based upon board approval, where the state of North Dakota basically, in effect, signs off that it's okay to move forth with a future project. A lot of the work that we've done in the past and projects that we did were lined up and ready to go at the time or before CARES Act dollars were available, and then before the required reporting, et cetera, existed. So we're being proactive in this regard with the reporting that we have to do with the state of North Dakota.
Yeah, thank you, Scott. The second paragraph basically gives a brief background of the ESSER funds that the school district has used to this point. It also points out that the district has an approximate $83 million in HVAC deferred maintenance needs across all of our campuses. In order to utilize this last, pool of funds that we have remaining, we would like to press ahead with a HVAC system upgrade at Ben Franklin Elementary. The campus at Ben Franklin still has some of the original HVAC systems that are within that building and are at failure, and in fact this morning were not working. We were able to get them going, but they are no longer functioning, and we would really like to press ahead with a complete replacement utilizing displacement ventilation at Ben Franklin. This would also touch ancillary electrical and control systems involved with that process. This would all be wrapped into one project. We are approximating the value of, and this is pre-COVID, so anything is kind of, possible at this point. We were approximating the value of that project to be right around $3.6 million at the time. This would allow us to have a little extra money as costs, gain or lose here. So,
Clarifying questions or comments for Mr. Arnold? Chris, is this anticipated to be done in 2022?
It's going to likely take us 2 summers. This is going to be a very invasive project at Ben Franklin. We will be touching every classroom, including mechanical rooms, and then also likely doing some upgrades on the roof to support the new systems.
Any other questions or comments? If not, do we have a motion to approve the administrative records? We have a motion by Bill. Do we have a second? Second by Doug. Assuming a roll call vote, all those in favor, please state aye.
Aye.
Aye. Opposed, same sign. Motion carries. Thank you, Chris.
Thank you.
Let's move on to item 7G, the Clark and Midkiff research request on electronic pages 116 through 148. Dr. Brenner.
Thank you, board members. This is a pretty straightforward request. As long as we have our new policy in place as adopted through the North Dakota School Board Association, this request does touch on some of the caveats within that policy. So this request does need to come to the board as a result of what their research is about. Dr. Harrison has already met with a couple of teachers who are willing to voluntarily participate. And with the board's support, we would also, from a district leadership perspective, support this research request. So the administrative recommendation is to allow Clark and Midkiff to proceed with their research following the guidance of policy GCC.
Clarifying questions, comments? Seeing none, do we have a motion to approve this request? Moved by Bill, do we have a second? Second by Chris. Assuming a roll call vote, all those in favor, please state aye. Aye. Same sign for those opposed. Motion carries. Let's move on to item 8, which is other announcements. Dr. Brenner?
No announcements, sir.
Catherine or Brenda, do you have any announcements? Scott, you got any accounting announcements for us?
You can start filing your tax return on January 24th.
Thank you. Appreciate that. We're all looking forward to that. Thank you. Board requests for future consideration. Do we have any board requests for future consideration? Cynthia or Shannon?
No, thanks.
No.
Thank you. 8C, board norms. How did we do, Bill? Okay. Well, thank you all. I know it was a long meeting. I'll give you 33 minutes back of your life, so have a good evening.